Hey everybody, today I just want to take a couple of seconds to talk about spinal cars for you guys at home, very similar to the way that we might prescribe them to you in the clinic. So like any other cars, we're going to start our positioning by setting tension first, all right? One of the preferred ways I usually try to teach patients to set tension is simply just cross their arms over their chest, keep their head kind of pulled down, and almost kind of draw their elbows in toward one another and themselves, like you're just basically giving yourself a big hug, okay? Once you get there, establish a comfortable tension. Again, we're going to stay around 10 or 20%. What does that mean? Well, squeeze yourself as hard as you can, cut that effort in half, and then cut it in half a little bit more. Now, once we get into the start of our spinal cars, the important thing to remember is that we're not going to be experiencing a very large range of motion here. The other thing we want to consider is that we're going to be in cement from the waist down. So as we go forward, an extension, or sideways, okay, we want to keep our pelvis set. So we don't want to see any movement happening like so, because really right now we're trying to isolate movement and tension around our spine. So let's practice. If we cross our arms across here, pull your chin down, set tension. First thing we're going to do, melt forward, almost as if you're pulling your elbows into your pelvis. Once we get to the end range, we're going to pick a direction. In this case, let's go left. We're going to take that left shoulder, pour it to the side. Once we get to our end range tension there, we're going to take our right shoulder and pull back. Let the other shoulder come with it. And now I'm going to be going into extension. From extension, I'll let my right shoulder dip down. Once I get to my end range there, that's where I let the left shoulder roll forward. And then back to center, okay? So if we looked at it from the side, okay, I'm going to keep my hips and pelvis set. I fall forward. I fall to the left. Or go back. Through extension. Down to the side. Once I feel the end range hit at the side, that's when I come across here and then round out. So we really want to think about letting all of those segments kind of pick up tension in the previous one, and then that way we can really kind of bend like flexible steel, okay? Now, very similar to our closing angle pinches and pains that we want to stay away from, clearly anything that causes your symptoms is a no-no right now. Anything that causes your closing angle pain, so in this case it would be, if I go backwards, this is the closing angle because my two joints are coming together here. So we want to stay away from any pain on this side. Or if I'm side bending to the right, that would be a closing angle pain right here. Closing angle pain the other way right here, okay? So if you guys experience any of those, let one of us know. We can review them with you and go over it and make sure you are staying safe at home. And that's spinal cars.